Assalamu alaikum class. The topic of today's tutorial is tuberculosis, treatment of tuberculosis and leprosy. The first part is treatment of TB. Now coming how you are going to cover the topics introduction, theology and risk factors, pathogenesis, types of TB, clinical features, diagnosis and treatment. Introduction of TB. It is an infectious disease caused by various strains of mycobacteria, usually Mycobacterium tuberculosis. Tuberculosis generally affects the lungs but can also affect other parts of the body. It is spread through the air when people who have an active TB infection cough, sneeze, or otherwise transmit respiratory fluids through the air. Here is a picture of Mycobacterium tuberculosis. Etiology. Other than Mycobacterium tuberculosis, other Mycobacterium which can cause TB are M. bovis due to unpasteurized milk, M. africanum, M. kenneti, M. microti. Non-tuberculous Mycobacterium include M. lepri, M. avian, and M. concise. Risk factors of TB include children and elderly, immigrants from high prevalence countries, close contacts of patients with smear positive pulmonary TB, overcrowding like prisons, immunosuppression like AIDS, malignancy like lymphoma and leukemia, primary infection, and smoking. Now, the types of TB. The first type being primary TB, pulmonary TB. It is caused due to the inhalation of droplets containing organism Mycobacterium TB, formation of Gown complex. It is often asymptomatic in early stages and usually does not progress to clinical evident disease, but it may be detected later. Secondary TB, which is caused by the activation of a prior Gown complex, with spread to a new pulmonary or extrapulmonary site. Miliary TB. Lymphatic and hematogenous spread may cause miliary TB. Extrapulmonary TB. As the name indicates, that TB will be including or affecting the sites other than pulmonary sites. Being common, the most common are being lymph nodes, which are the most common extrapulmonary site of disease affecting cervical and mediastinal glands, axillary, inguinal, and supraclavicular lymph nodes. Other types. GIT tract, it may involve other than lymphatic node, it may involve GIT tract, commonly involving ileocecal junction, and cardiovascular system. It can cause two conditions: pericardial effusion, constructive pericarditis. In central nervous system, it can cause meningitis. As far as bone and joint are concerned, it can involve vertebral column, resulting in Pott's disease. It may also cause genitourinary infection, may involve kidneys and serous membranes. Now, the clinical features of a TB patient. For example, how a physician is going to observe a TB patient with what clinical features. In pulmonary or primary TB, you will see a influenza-like illness, chronic cough with hemoptysis, pyrexia of unknown origin, weight loss, skin test conversion, unresolved pneumonia, asymptomatic diagnosis on chest X-ray, which usually takes 4 to 8 weeks. Secondary TB. In secondary TB, you are going to see fever, hemoptysis, pleural effusion, generalized wasting, and progressive disability. Clinical features of miliary TB includes 2 to 3 weeks of fever, night sweats, anorexia, weight loss, dry cough. Hepatosplenomegaly. Fundoscopy may reveal choroidal tubercles. Chest X-ray may reveal 1 to 2 mm fine lesions, millet seeds distributed throughout lung field. Anemia and leukopenia. Diagnosis. How you are going to diagnose a TB patient. First of all, you are going to take a detailed history For example, the symptoms history, any travel history, family history. You are going to examine the patient, journal physical examination, and the systemic examination. Then you are going to send some labs, baseline investigations like CBC, CRP, ESR, urea, electrolytes, LFTs. You are going to give a chest x-ray, sputum examination which may reveal 5,000 to 10,000 organisms, tuberculin skin test, staining like Zeal-Nansen, auramine fluorescence, culture like solid media, liquid media. You can also perform a Mentox test. Now here are some pictures of TB X-ray showing the lesion. Second X-ray showing calcification in lung field. Now the treatment. The treatment period is divided into two phases. First, the initial intensive phase and the second phase being continuation phase. As the name indicates, initial intensive, in which you are going to start the intensive therapy whose goal therapy is to reduce the bacterial population. It is of 2 months duration. 4 drugs are used: Isoniazid, Rifampin, Pyrazinamide, Ethambutol. Now the treatment continuation phase. 4 months duration, 2 drugs are used: Isoniazid and Rifampin. If there is a need of extended treatment for people with HIV positive, miliary TB, meningitis, tuberculosis, osteomyelitis, you can extend the treatment for 9 to 12 months. Now coming to the drug dosages. Isoniazid is given 5 mg per kg. Rifampin is given 10 mg per kg. Pyrazinamide is given 15 to 30 mg per kg. Ethambutol is given 15 to 25 mg per kg and streptomycin is given 15 mg per kg. A combination of 4 ETT drugs except streptomycin is available in market known as Myrin P, which is given 3 to 4 tablets.